Hello and welcome back to the Damn Yankee Blacksmith Shop. Well, today I'm going to talk to you about something that happens to everybody who blacksmiths and everybody who welds also. Anybody that deals with heat on a regular basis, and that is burns. First, we're going to talk about the types of burns, and then we'll talk about what I see as treatment. Nothing in this video. This is a disclaimer, a legal disclaimer. I am not a physician. I am not a medical professional. These are things that I do. Before you do any of them, do your own research, do your own due diligence, check with your primary care physician or PA or nurse practitioner or whoever you deal with. First, we're going to go over what burns are. They are damage to your cells through radiant heat, be that from a nuclear bomb, the sun, or a piece of hot steel, or an arc weld. All of it creates radiant heat, which transfers to the cells of your skin and damages them. We have 4 degrees of that damage. They are first, second, and third, which are the most common, and then 4th degree. We will talk about 4th degree separate, since it is harder to deal with and more damaging. Now, 1st degree burns. Those are commonly called sunburns. Welders get them when they are welding without protection over their skin. Short sleeve shirts, when you're MIG welding, will get you a sunburn on a cloudy day. The burn is created by the flash. The heat is actually transferred, just like on a when you use a magnifying glass. The heat is transferred to your skin, and that damages the top layer of the dermis, or the skin. That creates a reddening, a swelling sometimes, and pain. Painful to the touch. You'll notice that when you touch it, your skin will go from red to a pale and then turn back red. Now, this is uncomfortable, but it's rarely damaging until you get older in life and it tears up your skin. You get wrinkled skin and stuff, but that is a beauty care thing, not a welder blacksmith thing. The way to treat it fast is with some form of skin cream that covers the skin and keeps it moist, preferably not oily. My preferred is right here. I started using this on tattoos, and it works real good. It doesn't leave a greasy covering, but it does heal real fast. And I did it on a sunburn one time, and I was amazed. The sunburn didn't even peel. It just cooled off and disappeared, turned tan. 2nd degree burns. 2nd degree burns are when blisters form. 2nd degree burns burn the top layer. The body protects itself by putting out a layer of white blood cells, and pus fills up the bag. If you get a blister, do not break blisters. Blisters are providing a barrier between the air and the wound. That is a good thing. Sometimes you can't help. This is a 2nd degree burn right here, but it was a burn from a cross that I was making, and it touched and it drug across, which actually scarred the skin or scratched the skin, which didn't allow the blisters to actually form. It remained a 2nd degree burn because the layers of dermis were not damaged further down. The blisters never formed into blisters, but there was a layer of burnt skin on top. I left that on there, and I used something that you can use. This is a prescription only drug because it is a sulfa drug, and if you are allergic to sulfur, it will hurt you bad. But a lot of welders know of it as Silverdine. The correct name is silver sulfadiazine. It is a prescription drug. You keep it in the refrigerator, It'll last forever. I don't care what the expiration on it is, but I don't even think it has an expiration date listed on this. Oh yeah, it does. This one is 6 years past its expiration. The silver doesn't go bad. The sulfur doesn't go bad. Keep it in your refrigerator, and it is a white cream that goes right onto the wound. Is extremely pleasant feeling because it's cold when it goes on there. Even if it's not been in the refrigerator for a while, it feels cold when it goes onto a burn. It stops the pain pretty quickly, and it is a good antibiotic. It is, again, silver sulfadiazine. It is an astringent, so you use it for 3 days, changing the bandage twice a day. I usually do it when I wake up and when I go to sleep. That bandage should be lightweight gauze. You have a wrap gauze that you can go around with if it's a big area, and padded gauze if it's not such a big area. And then you can use, this is what I use on any injury that I get. This is called Elasticon. It is made by Johnson & Johnson, and it makes Band-Aids look sick. If you need to cover up something, let's say you smash your finger, cut your finger, and everybody knows that it's a pain in the butt when you mash your finger because it keeps catching on stuff. If you wrap this, that is now if it's wrapped and touched together, that can be bent. It stays secure. It can get wet. This stuff is awesome. Elasticon by Johnson & Johnson. You can get it on Amazon. I buy it by the case because I'm always hurting myself at some point. And if the bandage is going to be coming off in sweat, I just wrap the bandage with the Elasticon. It doesn't have to be tight, but that keeps the bandage in place where normal bandages will pull off. Third-degree burns are treated almost identically as second-degree burns. The difference is that the blisters form larger and they open up. They actually break immediately after they form because the skin damage is too high. The damage into the skin is further in. It can go all the way down to the lowest level of the dermis. There's 7 layers to your skin, your dermal layers. These take longer to heal. Again, 3 days with something like this, an antibiotic that is made for burns. Some people use gel but the idea is to keep it moist. Do not ever let a burn dry out. They will crack, bleed, and get you infected. Once you've used the Silverdyne for 3 days, then use any antibiotic ointment, Neosporin, triple antibiotic, whatever. It doesn't matter. Keep the wound moist. Changing the bandages every day. Clean it off. It means in the shower, you actually wipe the dead skin off. Then, again, bandages will get less and less every day because the area will start to close up. If you do that, you will note that around the edges of the burn will not be red. The actual burn will be red because that's going to be scar tissue, and it's going to go away after a few years. But on the outside edges, as it's healing, it should not be red or inflamed. That is infection. If that happens, go back to your doctor and make sure you get taken care of. As long as you keep it moist, it won't happen. Clean the wound, keep it moist, keep it covered. 4th degree burns. 4th degree burns are when the dermal layer is completely destroyed. This happens when you hit something that is red hot. This was still a black heat. This was maybe 800 degrees. And it just a millisecond on my skin, and I got damage. If that would have been glowing hot, that skin would have turned to ash that fast, white ash, and it would have gone down into the meat and into, in severe cases, you go through the meat and into the bone. If you have a 4th degree burn over more than 3 or 4% of your body, you're in very bad trouble, and that means death is possible at that point. 3 or 4% of your body is not that much. Call that from here to the end of the arm. If you get that much 4th degree burns, you can isolate that with a tourniquet, but your arm is gone at that point. We get them as blacksmiths and welders over maybe a steel rod hitting you, or across the arm is real common, or across the hand is real common. If the skin is completely turned to ash and you're looking at meat, that is a 4th degree burn. I recommend seeing a doctor, because sometimes you need skin grafts at that point because the skin is gone. If it's small and you think you can deal with it, you treat it the same way. It's going to take longer. Silverdine for 3 days. The reason, it's an astringent and it will keep the wound open. You don't want to use it more than 3 days. Then keep it moist, keep it loosely covered, not tight, but loosely covered and taped from the sides. Keep it protected, keep it moist, and I recommend, if you got 4th degree burns bigger than the size of a dime, you better see a doctor, because you're probably going to have an open wound for a long time. And that is 12 minutes on how to treat burns from a guy who gets burned on a regular basis. If you have questions, ask them down below. You can find, again, all these products are at CVS, Rite Aid, Walmart, you name it. You can get Eucerin cream or any other sunburn cream will work for 1st degree. Talk to your doctor about getting a prescription for silver sulfadiazide. This has been in my refrigerator for 7 or 8 years. It is still good. I can tell you it worked real well. Neosporin, it's what I use because it's got a pain reliever in it. Triple antibiotic, whatever else. An antibiotic cream or ointment is my preferred, but you can use creams too. They just need to be used more often. Bandages. Learn how to use a bandage. Look it up. Take a class in first aid. Wrapping gauze. Don't just use wrapping gauze. Use a bandage too. After that, you can use Band-Aids, but I recommend covering the Band-Aids in Elasticon. If you have questions, ask them below. If they're specifically medical, I'm going to tell you to ask your doctor. If they're about one of these products, I'll be glad to explain more further down below. I hope this helped. I hope you don't get burned, but if you do what we do, you're going to get burned. It's just mitigating the damage. Hard asses that believe that you can just leave the air, get to it, it'll be fine. Those are the people that end up with motion restrictions because of scar tissue. And they also take a hell of a lot longer to heal. Make sure you put and keep a wound moist. It'll heal 10 times faster than a wound that's left to dry. And that's it. I hope to see you next time. I'm going to try and get more videos out. I'm by myself here. I don't have anybody to hold the camera for me, so I don't do a lot of videos because I'm busy working. If you want to see something, ask, and I'll do my best. Talk to you later. Bye.